Yeah, this is at St. John Ambulance. I am learning about how to save lives, first aid, CPR, and AED. So I've already learned how to take care of a number of issues in case of any casualty. And this is a dummy person that I have been using to learn um, how I can do the CPR, how to do this, and how to ventilate into somebody's mouth just in case they are not breathing and they need my support. So I have to be sure that I have protected myself, and so I have to be safe. So the first thing that I need to do when I am administering first aid or helping someone, I have to first consider protecting myself. So I have to be sure that I have all my um, protective stuff, my gloves. I should have my gloves on always before assisting any casualty. Now, when it comes to first aid, we don't deal with patients, but rather we deal with casualties because it's only doctors who can deal with patients. A patient is somebody you need to check on time and again until they fully recover. But for a first aider, you are supposed to help as much as you can to ensure that that person stays alive before a doctor arrives, or if you can, help them to get to their level. So, for purposes of ventilation, I have to be sure that the head is raised, the airway is open, and I start. So I have to do like for every 1 minute, I need to do 120 uh, press, press ups. Yeah, they press the chest 120 times, 30, and then two ventilations, 30 of them, then two ventilations until the person recovers or until help is found. So I have to do this for an adult or a child or an infant. When it comes to first aid, an adult is considered any person from the age of 8 onwards. A child is from the age of 1 to 8, and then an infant is from birth to 1 year. Yeah, this is what I'm learning, and I think it is a skill that everybody needs, especially anybody dealing with people, like the teachers in our schools. It is important for every teacher to get to learn how to do basic first aid and CPR, because when our children are playing, it's possible that they can get injured. Even at home, you need to have the skill how to conduct first aid or how to do CPR. Because when we talk about AED, let me just show you what it means. This is basically a machine. So when we go to the next level, it will require that you you must have the money to buy the machine. But the basic things that we need at home or at school is first aid and CPR. I hope you're going to take this seriously so that we have all our teachers in our country getting to learn basic skills of first aid and CPR. Very important because wherever people are, the possibility of getting risks, the possibilities of getting danger they are there. So let us embrace all the students, for example, that are in the St. John ambulance clubs or the Girl Guides, but rather I will advise that every teacher in our schools should go out there and learn about first aid and CPR. Thank you.